Okay. Good morning, everyone. Thank you for joining the San Francisco Department of Public Health's press conference for a COVID-19 update. Please note this press conference will be recorded. For Q&A, please state your name, outlet, and up to 2 clearly stated questions in the Zoom chat. And now we welcome Mayor London Breed.
Thank you, and good morning, everyone, and thank you for being here today. Today, as we continue to see our COVID cases reach record levels, our 7-day case rate is 1,386 new cases per day. And while this is very challenging, I can only imagine what we would be saying if we were seeing these case numbers before we had the vaccine, because while the number of people in the hospital has gone up, we are still below last winter's peak. And as of today, we still have a significant number of city workers in quarantine, including 132 sworn officers of the police department, 140 members of the fire department, 167 MTA workers, and over 250 staff from San Francisco General. Our workforce is stretched, but they are holding through this surge to provide the services that our residents need. I really want to thank all those who are stepping up, working overtime, covering shifts to keep our city safe and moving forward. We know this is a really tough time, but like I've said in the past, we are learning to live with COVID, and that means everyone assessing their own risk. It means making smart choices. It means doing what's best for our own health and the health of our families and our community. It does not mean imposing new restrictions. That's not what we are doing. We will continue to push forward policies to expand testing, get people vaccinated, and ensure access to care so our schools and businesses can stay open. These next few weeks will be very, very hard, but we will get through this as we have before. And as we navigate this surge, we know testing is a major issue. This is a problem not just here, but all over the country. The truth is the Department of Public Health has pushed its capacity during this latest surge, doubling our testing from early December to more than 10,000 tests per day. But to meet the current demand and to support our residents, we need more from our private healthcare partners. In August of 2021, the Department of Public Health issued an order requiring all healthcare facilities to provide a test within 24 hours when a member of their system or their staff is symptomatic or has been in close contact of someone with COVID. This health order is so important and it needs to be followed. And right now, that doesn't seem to be the case in all instances. So today, I'm announcing a mayoral order requiring all healthcare providers to submit weekly proof to the Department of Public Health that they are meeting this goal. And if they don't, they could be subject to fines. And to be clear, this really isn't about punishment. It's about everyone doing their part. And our private healthcare providers need to do their part for our members so that our city is not overwhelmed and not able to provide testing in a timely manner. Throughout this pandemic, our entire medical system, both public and private, we've worked together to provide the best care and the support to the city and the county. And today is no time for us to go backwards. And that's why we need all of our private healthcare providers to step up and do your part and to not just send people to the city resources, but to make sure that you're providing resources that the members and the city are paying you to provide. I'm hopeful we can continue to work together to make sure that testing is available for more people. We also know there has been a lot of questions about the schools, and I want to start by appreciating all the staff that are continuing to show up in the classroom. There are a lot of concerns out there and we want people to feel safe, but it's also important that we do everything we can to keep our schools open. Our public health experts have been clear. With the right policies in place, our schools can be and are safe. Today, we have Superintendent Dr. Vincent Matthews here to discuss everything our schools are doing to support our families and our workers. The city has been working very closely with the school district to identify their needs and see how we can help. We've done this since the very beginning. And over the last few days, the school district has made 2 asks where we can help when it comes to testing and masks. With testing, as I said before, it's hard everywhere right now. It's a struggle, both for the rapid testing as well as the PCR test. But we have heard from the district that they need help with rapid tests for quarantine educators who are trying to test after 5 days to get back into the classroom. That is a key piece of making sure our classrooms can stay open. To support these efforts, we have supplied an initial 1,000 rapid antigen tests to the district, with more to come. And we've heard that there is need for more masks for students and educators to get us through the rest of the school year. The district, from my understanding, and Dr. Matthews can talk a little bit about this, they have enough supply for the next 30 days as it relates to masks. They've received a significant number of tests from the state, and we are consistently working with them to provide additional resources, including just recently 150,000 KN95 masks for staff and 500,000 surgical masks for students. I want to thank our City Administrator Carmen Chu and Maria Sue from the Department of Children, Youth, and Families, who have been working very closely with our departments and district representatives on these issues. And I know that they will continue to work with the school district moving forward, and we will do everything we can to be as supportive as we can of keeping our children in school. As Dr. Colfax will explain, we don't expect this surge to be long, but the reality is we are going to need tests and masks even after this surge of cases eases. None of this is easy, but we're going to keep working together to support everyone in the city. It's how we lead the way during COVID, and it's how we will keep moving forward. And now I'm going to turn it over to Dr. Grant Colfax to talk more specifically about where we are.
Well, good morning, everyone, and thank you, Mayor Breed, for your ongoing leadership during this pandemic. I want to thank San Franciscans for their patience, their steadfastness, their resilience, and their cooperation as we make it through this challenging time. As the mayor stated, we are now at an all-time high in cases, and I want to acknowledge the ongoing and increasing challenges we are facing, at least for the short term. From access to testing, to frontline staffing, to first responders and hospital staff being out due to infections or exposures, to higher numbers of people in the hospital. We are in the middle of the worst of this Omicron surge, but we can, and we should, and we must be looking to the future. Many of you may be wondering what comes next. We have reason to believe, based on data from other parts of the world, like New York and South Africa, that we could be starting to turn a corner soon. But we are not there yet. In fact, let's look at where we are right now. First slide, please. We are continuing to see an unprecedented number of COVID-19 cases, far outpacing any other previous surge, with more than 149 COVID positive cases per 100,000 people here in San Francisco. And just to put that in perspective, our prior highest surge numbers were about 42 per 100,000. Broken down further, it's an average of about 1,250 San Franciscans per day that are testing positive for COVID. And right now, nearly 1 in 5 tests are positive. And it is likely that that rate will continue to increase over the next few days. Next slide, please. And in keeping with these very high case numbers, our hospital census continues to climb. Now, I want to emphasize, given our case rate, these hospital numbers are not climbing nearly at the level that they would have if we didn't have such great coverage with vaccines and boosters. Vaccines and boosters remain the bulwark of our protection against the most serious consequences of coronavirus, including and especially Omicron. I can report that San Francisco mirrors national trends, with a small fraction of those hospitalized with COVID being boosted. And as we know, during the surge across the nation, the vast majority of those who are hospitalized and sadly dying of COVID are either still unvaccinated or are not up to date on their vaccinations. We are optimistic, and you can take down the slides, please. We are optimistic that because of our city's high vaccination and booster rates, we will get through this Omicron surge without running out of those all-important intensive care unit beds. But we also need to think about our hospital capacity in a holistic way. Hospitals support people not only diagnosed and suffering from COVID, but with all other sorts of medical conditions. We need to support these people too, and our medical staff are working hard to continue to do that. This is one way we can think about the future, situating COVID, which we know will be with us in the foreseeable future, into the broader system of diseases and conditions that need our care, expertise, and condition. That is why, as we learn to live with this virus, and indeed, Omicron has shown how important it is that we do indeed learn to live with this virus, that we are focused on hospital capacity far more than case rates. After all, if you are up to date on your vaccinations, it is extremely unlikely you will be hospitalized due to COVID. I want to take a moment to provide an update on testing in San Francisco. San Francisco, as the mayor has mentioned, has been testing at rates unparalleled to any other time during this pandemic. And we've had challenges as well. Our testing infrastructure is also affected by workers getting sick and the high demand on our systems. Our partners and contractors are experiencing that too. And I am very proud of how the city has scaled up testing over the last month. We have more than doubled our testing capacity since the surge began, and now are averaging more than 10,000 tests per day in San Francisco. And in fact, last Monday, we broke our previous record, conducting 17,731 tests in just one day. Our testing averages per population exceed the state average, well exceed the state average. Even still, the demand for tests remains high, and I understand that people are anxious and frustrated. We saw this weekend that happened this weekend with a number of people with COVID symptoms calling 911. It's become apparent that during this surge, we need to take a more robust approach to expanding our testing infrastructure in place to weather future surges. This means widely available and affordable over-the-counter test. And of course, we need all of our health system partners to step up and do their part to meet the needs of their members, staff, and patient. After all, COVID will be a disease that is with us for the foreseeable future. Look, I know this is not how we wanted to spend the first month of 2022, but we will get through this. There are concrete things that you can continue to do to have an impact right now. I'll say it again, please get vaccinated, and please, please get boosted. Wear your mask and upgrade to an N95 or double cloth, or wear a double mask with a cloth and surgical mask. Avoid large crowds and take extra precautions around those who are still unvaccinated, like our young children, and continue to practice safer behaviors around our elderly and immunocompromised. Things will get better. This surge will recede. Let's do what's right for ourselves and our community right now. But let's also think about what comes next. How will we come out of this latest surge? What is Omicron teaching us? This virus is adapting to us, and we need to adapt to living with the virus. We are honing our skills right now, learning how to manage a highly contagious yet less severe form of the disease that will be with us for the foreseeable future. We are seeing where our systems need strengthening, at the local, state, and federal level, including access to testing. And we are gaining even more tools to battle this disease, from those boosters to antiviral medications that are just beginning to arrive in San Francisco and that will help prevent severe infection of our most vulnerable. We all have reason to hope. And in this first month of 2022, I am cautiously optimistic that we will continue to learn to live with this virus and come out a vibrant, strong, and healthy city. And now it is my pleasure to introduce Superintendent Vincent Matthews. Thank you.
Thank you, Mayor Breed and Dr. Colfax. And I want to thank everyone else who is here today. I'm Vincent Matthews, the superintendent of the San Francisco Unified School District, and I want to express my sincere gratitude for everything that the San Francisco Unified School District staff, student, and families are doing to keep each other safe. Back in the summer of 2020, what I urge us all to do is to take care of each other. And I just want to once again express my sincere gratitude for the city of San Francisco in doing just that. I also want to thank the community from the bottom of my heart. From our city agencies to our business community, we're working together to keep schools as safe as possible so our students can learn in person. Throughout this pandemic, we've been fortunate to work with some of the best public health experts in the world right here in San Francisco. Today, I'm going to share an update about some of the steps we're taking to keep San Francisco public schools open for in-person learning during this stage of the pandemic. Can we put up the first slide, please? San Francisco Unified is operationalizing one of the largest COVID-19 testing efforts in the city. Please keep in mind the district was not created to be a testing agency. We're an educational agency, but we pivoted and become one of the largest COVID testing efforts in the entire city. We've made reliable testing regularly available to students and staff since last spring through our partnership with Color. Color PCR testing is available for all students and staff at school sites. In addition to the Color testing program that we've been running for almost a year, during this Omicron surge, we have partnered with Safer Together to make rapid testing available to the community at school sites and district offices. Mobile rapid testing will continue to be available throughout January. We are working on continuing rapid testing into February and possibly adding additional sites. In addition, even amongst a massive shortage, we have received a distributed rapid test from the California Department of Public Health, the business community, and the San Francisco Department of Public Health. By the end of this week, every student and every classroom teacher will have a take-home test kit for their use in the event that they are symptomatic, a close contact, or have had a known exposure. Next slide, please. We've administered nearly 5,000 rapid tests between Sunday, January 2nd and Sunday, January 9th. I'm going to repeat that. We've administered nearly 5,000 rapid tests between the time of Sunday, January 2nd and Sunday, January 9th. And between January 2nd and January 7th, we've distributed 2,200 home test kits. Almost 10,000 color self-swab test kits have been processed between January 3rd and January 9th. Last week, we delivered more than 46,000 color PCR tests to school sites, with even more being distributed to schools this week. And this week, we're distributing the 56,000 at-home test kits from the California Department of Public Health to all schools. Every one of our public school students in San Francisco will have a test kit at home. You may close the screen sharing now. We have been and continue to share regular updates and testing opportunities with families and staff via text message, phone calls, and email. Prior to school reopening last week, we encouraged testing and sent out information about numerous ways to get tested. We know that many students and staff found ways to test and followed protocols. If they tested positive or had symptoms, they did not come to school. We are and have been working closely with the San Francisco Department of Public Health with implementing the protocols they recommend. I'm going to talk about masks and other PPE. We have distributed PPE, including tens of thousands of surgical and cloth masks, as well as some KN95s to all schools since reopening for hybrid learning last spring. The guidance at this time is loud and clear. Any well-fitted mask is essential, and some masks are even better than others for preventing transmission of the virus. We're distributing over 73,000 KN95 masks to schools this week for school staff. The business community and city are also working with us to procure more KN95s and KF94s so we can keep our staff equipped with daily access to these masks. We are also distributing over 350,000 surgical masks for adults and 305,000 surgical masks for all youth at our schools. In addition, nearly 200,000 reusable masks for both students and staff are going to schools in January and February. San Francisco Unified continues to follow public health guidance, and schools have remained low-risk settings by following proper safety protocols. Even though we're seeing a new wave of community transmission, and that includes our schools, we're committed to keeping our schools open with regular access to testing and all other safety protocols our partners at DPH recommend. In-person learning offers the best form of instruction for our students, and we believe school remains a safer place for our students than the alternative. In spite of the pandemic, our schools continue to be places where students receive free and nutritious meals, where they continue to learn how to play an instrument and get involved in a sport, where they have their curiosity sparked and find joy in learning, and where meaningful relationships are formed. Thank you for your time today, and I now turn it back over to the Department of Public Health.
Thank you very much. Thank you, Mayor Breed, Dr. Colfax, and Dr. Matthews for your remarks. We also have Health Officer Dr. Susan Phillip on hand to answer questions. Before we start the question and answer portion, we are going to take a moment to allow reporters to submit additional questions on Zoom, and then we'll get started. Okay, I see we have a number of questions coming in. Thank you for your patience. Dr. Colfax, when you're ready, we'll get started with the Q&A.
I'm ready, thank you.
Okay, great. Dr. Colfax, your first question comes from Leslie McClurg at KQED. How does Omicron compare to the flu in terms of its severity? Is it similar? If it's similar, is it time to normalize COVID like we do the flu and lift restrictions, quarantines, et cetera?
So good question. I think that the bottom line is if you're up to date on your vaccinations, including getting a booster if you're eligible for one, the severity of Omicron is severely, the impact that you would have, the chances you would have severe consequences from an Omicron infection are dramatically reduced. So just to emphasize that. I think right now we are in the middle of the biggest surge we've seen. You see the hospital numbers continuing to rise. So in the foreseeable future, yes, I think we're going to need to learn to live with COVID, whether it's an Omicron variant or another variant. And I think we're going to need to adjust to more of a normalization of living with COVID, hopefully in a population, both locally and nationally, has immunity conferred by up-to-date vaccinations. Because right now, these vaccinations continue to be our best tool to mitigate the effects of this virus. I'm also hopeful, as we are being told that the supply of effective retrovirals will be improving over the next number weeks and months, that's another tool we will have in our toolbox. So of course, the ability to expand testing for people so that testing becomes more normalized and our testing systems across the country become more robust, that we do have the tools that we need to better live with this virus, understanding that people will still be at various risk levels, just as they are, as you're pointing out, for the flu. So I think we will be heading in that direction. But right now we have to also acknowledge that we are in the middle of just skyrocketing numbers and cases. We need to manage this right now in a way that is reflective of the severity and of the fact that infections are storming through our city. When that case rate comes down, and again, our models suggest that they're going to come down relatively quickly, we still need to be vigilant, but we will be most likely in a place where we're better able to learn how to live with this virus, minimizing our disruptions. And the way to do that right now is for everybody who's eligible for a booster to get that booster. And for goodness sakes, if you're not vaccinated, start your vaccine series. It is not too late.
Thank you, Dr. Colfax. As a follow-up, we have multiple outlets asking about color testing and the technical issues that we are currently experiencing with the color system. How much have the technical issues experienced by color impacted the city's testing capacity? And has color determined what caused this technical issue and when it will be resolved?
Yes, so I want to iterate how much testing we have been doing, and our teams have scaled up testing dramatically over the past few weeks. Again, that record number of tests done, 17,000, averaging over 10,000 tests a day. Remarkable increases at our sites operating at capacity, 500 and 900% capacity in order to test as many people as possible, including people with appointments and with drop-ins. Now, the color, the fact that the color system went down nationally, this was a national issue, obviously was extraordinarily concerning and has had a major impact in the last 24 hours in our ability to provide testing for people. And we are working to ensure that color fixes that problem as quickly as possible. I would refer you to color for the details in terms of their determination of why their systems went down. This was a national issue. This was not limited to the local issue. Today, we're working to ensure that people who had appointments at color sites are getting access to testing. Again, if they have appointments, we are asking that they go to Southeast and our Alamany site to avail themselves of testing. And we have been working with Color and doing everything we can to support them in getting their systems up as quickly as possible. And we are being told that will happen in the near future.
Thank you. One more question on the testing front from Max Darrow, KPIX5. Since we've had testing sites overflown, some have had to shut down due to staffing issues. What is your response to those who say that the city could have been better prepared on the testing front?
Well, I would go back to the fact that we have a number of sites across the city, an ecosystem of sites that again have been breaking records in terms of number of tests being done. And I would also add that part of the reason we issued the order was issued today is we need all of our healthcare systems to do their part as well. DPH the health department has shouldered the vast burden of this testing. And so as we learn to live with this virus, as testing demand ebbs and flows, we need to make sure that everybody is doing their part. And then I would also emphasize that, at the local level, we are doing everything we can at the health department to expand testing, not only in terms of staffing and physical sites, but we also basically need the raw materials to test. We have ordered tens of thousands of those home test kits. Those home test kits are finally starting to arrive now. That is a national and international issue. So we are doing everything we can at the local level to meet the demands for testing. The health department is doing that, and we are also standing shoulder to shoulder with our partners, similar to the way so many of them stepped up and worked with us in terms of delivering vaccines and continue to deliver boosters. That model is now needed for us to all support testing our communities as quickly and as rapidly as possible.
Thank you, Dr. Colfax. We have a few questions for Dr. Susan Phillip. The first question is from Catherine Ho from the San Francisco Chronicle. Can you elaborate on how this new order for private providers to submit proof of testing is different than your previous order from summer 2020 that required private providers to test patients?
Yes, thank you for the question. So the health officer testing order was in August of 2021, and it required that health systems and providers allow testing access for their patients within 24 hours, and that the test results return in 48 hours. And the goal, the marker was 90%, meeting 90% targets for those requirements. The order that has been discussed today by the mayor and others is an additional order. It is not from the health officer. It's an additional order to really, again, as Dr. Colfax said, recognize that many of our health system partners are meeting these requirements, but we want to make sure that it's fair and that patients throughout the city at all systems have this access that they need. So we will be re-looking at the reporting requirements and the overall requirements in the underlying health officer order. Our focus is really going to be on people that are symptomatic and contacts to cases of COVID-19. Those are the most important people to get tested within 24 hours and to get their results fast so they can act on them.
As a follow-up, what will private providers now have to submit to DPH as proof that they're meeting testing goals?
So what they will have to submit is not significantly different than it was previously under the order, and health systems have submitted data previously. And so we appreciate that partnership. So that will continue. And what they will need to tell us is that they are meeting these goals, that 90% of the times when patients are requesting a test because they are symptomatic or contacts to a case of COVID-19, that they are getting that appointment, getting that test within 24 hours of that request, and that they are then getting results from that testing within 48 hours, and that's happening 90% of the time. So those are the goals that the health systems will need to attest to and provide that data routinely to the Department of Public Health.
Thank you, Dr. Phillip. A couple more questions coming your way from multiple outlets. What metrics do you have in place to trigger a ban on large gatherings or shelter-in-place order, similar to the guidance we saw out of Sonoma County last night? And then for DPH, Sonoma County has issued these restrictions on large gatherings. Is that something that may happen here in San Francisco as well?
Well, I think as the mayor has said, our intention is not to impose additional restrictions. Of course, we will follow closely as we have the data around hospitalizations in particular, but it's our very, very high vaccination and booster rate and really the work of all the San Francisco residents, all of the partners in the community and our health systems and the city to really have that rate of vaccination be as high as it can. So at this time, I'm not considering additional restrictions in San Francisco, but as I said, we continue to follow the data closely and will make adjustments to that if needed with communication to the public and to other stakeholders. I will say that we have been very consistent in telling people that this surge is occurring as people can see and are experiencing as people around them or themselves test positive and know of others as well. So we do want people to take extra caution, wear a better mask right now, wear either a respirator or if you have a surgical mask, place a cloth mask over it to improve the fit. Consider what gatherings or what you are actually doing so that you prioritize the things that are most important to your livelihood, to your quality of life. And of course, we want to make sure that all kids are staying in school. So those recommendations continue, but we're not considering at this time additional restrictions on activities or sectors or recommending that people entirely shelter in place in San Francisco.
Okay, thank you. I want to give a little bit of time for Dr. Matthews. The first question is from Kathy Novak from KCBS Radio. What is SFUSD's current policy for students testing positive? I'm sorry, I'm losing it here. For students testing positive at school testing sites, are asymptomatic students who test positive sent home, and are families notified of positive test results?
Okay, so our policy is first and foremost, let me say that we continue to work closely with the San Francisco Department of Public Health to implement the health and safety protocols that are going to help us as a district mitigate the spread of COVID-19 in our schools. And so based on the updated public health guidance, and this was updated on December 31st, 2021, students and staff who have tested positive for COVID-19, so these are students and or staff members who've tested positive, are able to return after 5 days of isolation. Before December 31st, it was 10 days. But now they can return after 5 days if, and these is very three important ifs, if they no longer have a fever and their symptoms are getting better and they have a negative test collected on or after day 5. If they still have symptoms or they still have a fever or they don't have a negative test, then they must remain in isolation for the 10 days or until those symptoms get better. The symptoms get better, they no longer have fever, and they have a negative test. And both PCR and antigen tests are acceptable.
Great, thank you. Have you considered, another question for you, Dr. Matthews, have you considered allowing teachers to switch on Zoom in their classrooms through the surge for parents who at this time feel unsafe sending their children to school?
So one of the things that we know and what we're following is local, state, and federal health guidance. And health experts continue to and have over and over reiterated that schools have remained low risk settings by following proper safety guidance and protocols. So we still believe that schools are the best place, in-person learning is the best place. However, there already is an option for parents. We have an online school, and parents by state law can opt in and out of that process.
Another question from Sydney Johnson from the San Francisco Examiner for you, Dr. Matthews. Why did the district choose to not ask students and staff to show a negative test before returning Monday, January 3rd?
We know that I have the opportunity to talk to my superintendent colleagues at other districts regularly, and we all learn from each other. That's both here around the Bay Area, throughout California, and also throughout the state. And some of our colleagues received the take-home test from the California Department of Public Health before the break. We didn't receive our shipment until after the break. As a matter of fact, we didn't receive it till late last week, and it's already en route to schools. We're not going to ask for students or staff to do something that we know they don't have access to. So to ask, we encouraged it, but we knew if they didn't have access to it, it made no sense to require it. And you can see right now that people are scrambling to get access to rapid tests.
Thank you. This concludes our question and answer portion. We know we have many other questions coming in, but we do ask that you please reach out through our media desks to answer additional questions. Thank you, Mayor Breed and Dr. Colfax and Dr. Matthews for joining us today, and city colleagues for your time. For future questions, please email dph.press@sfdph.org, and SFUSD can be reached at newsline@sfusd.edu. Thank you very much. Have a great day, everyone.